everyone, welcome. This is the Voice of Eve. Our topic today is health innovation in Nigeria and Africa for improving life expectancy. Please stay tuned with us. We will soon be back. We can do better, ladies and gentlemen, on health expectancy than we are doing now. We need to live longer. At average of 52, we're not living long enough to make our contributions to this nation. And certainly, maternal health should be better. Our maternal mortality rate is alarmingly and woefully high. In fact, we're at the rock bottom of the rung of nations in that index. The Voice of Eve was at the Africa Health Innovation Meeting, organized by Friends Africa as a side event of the World Economic Forum at Abuja. There is need for accelerating solutions. That's the reason for the meeting. Some of the issues that came up at that meeting were better, stronger, better partnership between the private and public sector, less dependence on international agencies, more domestic financing, more creativity regarding solutions, better enabling environment, better resource management of what we have, better budgeting, really focused approach and working at it to make healthcare here better than ever before, to improve our lives and the quality of lives. At that meeting, it was agreed that policy should be better, leadership should be better, advocacy should be greater, creativity should be greater. Please join me as we listen to some of the excerpts. I am Dr. Violet Arene. Hello everyone, welcome. We are at the Yaradua International Conference Center in Abuja on the platform of WEFA. Our own segment is African Health Innovation, and I am so delighted. There are so many catchments here of people who are key on health innovation that I can interview, and you will get to see some of them. And you will be delighted to know that this is a wonderful opportunity for us to reprioritize our values on the value of life in Nigeria and to put health issues in the priority position where they should be, if ever we want to better our life expectancy, which is woefully low comparatively, because we can do better. So please join me. I am Dr. Violet Arene. Hello, Moji.
Hi, Doc.
It's a pleasure, a sweet, pleasant surprise, my seeing you here for this African Innovation Health Meeting, which is an adjunct of the WEFA, the World Economic Forum. Are you happy to be here?
Oh, sure I am. I mean, especially that we're looking at new concepts for the health sector. If you recall, that's what I've done all my life, reporting health. And so I think it's a platform to look inside and get new strategies that will work for Africa. Looking at, I mean, when you talk of Africa, you're talking of Nigeria, because for every 4 Africans, I mean, you can be sure that one will be a Nigerian. So I think that I'm excited about the whole concept of what Friends of Africa is doing here, and and I think we should support them.
Thank you. On my own part, I'm so delighted because we should be very concerned about the short life expectancy comparatively that we have in Nigeria. And we can do better, don't you think so?
Yes, I think we should do better, actually, because there's nowhere in the world that you go, particularly in the developed world, where you don't find rich human resources of Nigeria, playing their part in ensuring that the health system works, particularly now that the world has become a global village. And for Africa and indeed Nigeria, we have a double-edged challenge to deal with. We have the problem of communicable diseases and non-communicable diseases and limited resources in terms of personnel structure and even funding the health sector. So I think that, and I pray that this platform will provide the opportunity to be able to fast track or leapfrog, as it says, health, and making health as central to human development, to national development, to our very existence. So it's about time we start talking about health, because it's only a healthy herd of people that can actually drive the wheel of development. And we're not paying attention to health. I think it's about time we did.
I agree with you. It's about time, and especially for women and for children. Maternal mortality.
Yeah, maternal mortality.
It's the rates for us is just so amazingly depressing.
Yeah, very, very depressing. And at this point of our development, at the 21st century, women shouldn't be dying as a result of complications arising from pregnancy. Medicine, technology has improved to minimize the uncalled for. It's very depressive. High indices of women still dying from things like delayed labor, things like bleeding, simple things that should be taken care of even at the primary health care level. So this platform is good, and I hope it addresses, and I hope that actually it stimulates growth, not in terms of talk, but walking the talk.
Excellent. Walking the talk. And really showing practically the new value for African life or Nigerian life.
Yes, or for the women and children's life.
Yes, and the issue of all the perinatal problems, giving rise to a shorter life expectancy comparatively with Japanese women and others, can be surfaced in a platform like this. Yeah, sure. And if I agree that if we're talking about development, don't you agree too that health should be a priority?
Oh yes, I think.
What are you developing?
Yes, that's it. I always, and I've always advocated that health should be the top priority of any administration. We should ask for this. We should demand for it. It's our right. And you find out that it's not just about women or children or even our men. I mean, the man hours that are lost as a result of malaria, the man hours that are lost as a result of infections all over the place, as it affects the women, and it affects the men, it affects the children, and so they don't live to their full capacity. We lose them. We lose people too early because we don't have such facilities that can care for these people, particularly non-communicable diseases. Today you hear of cancers, you hear of high blood pressure, and these can be managed. So, and people live longer and healthier, in other developed world. Why can't we do it? And the people keeping them alive and making them live longer. Our Nigerians, our nurses are wonderful, our doctors, they are specialized in every field, but we need to create an enabling environment where they also can function.
I think this is an excellent platform. It's like bringing back the priority to the surface. And that's why I'm very delighted to be part of it. And I'm so delighted that a high personage like you is involved in it. I think we are doing just the right thing to reprioritize and re-strategize, to put the value for life in its rightful place, priority place, and knowing that we cannot afford to be losing manpower prematurely and unnecessarily. We can do better. And all we need is better leadership and policies and innovative creativity, and things will be better.
Yeah, like it said, It's doable.
It's doable.
It's achievable.
It's achievable.
And it's just commitment from every side, government and of course all of us. We also have individual responsibility. What you're doing, what we do through the media, I think goes a long way also to say that it's not so much that you expect government to do everything. Keeping your environment clean, going to do your medical checkup, particularly for women, taking the children out for immunization when it is due. All this collectively will breed that healthy herd of human beings that will fast track and leapfrog development in Nigeria.
I do hope this leapfrogging will take place because it has to be sustainable,
Yeah.
But definitely, this is putting us back on the right track, to put our priorities right. And it's such a pleasure interviewing you.
Same here.
Thank
Pleasure
you.
Speaking with you.
What role do you hope to play here?
Well, I come with the voice of the communities. And when I say the communities, I talk about both the infected and affected. And that takes, because this country and Africa entirely is made, you're either infected or affected. So I come with the voice of everybody to see where the gaps are, what the challenges are, what are we doing right and what are we doing wrong. Particularly, one interesting thing is the topic we're given, leadership, policy and advocacy. Because I'm going to ask a lot of questions. Are we actually leading properly? Are we following the policy properly? And the advocacy, where are the gaps?
A platform like this helps us to put our priorities right. If they were, people who are concerned can take seriously declarations and follow up, and monitoring.
That has to go with policy. When you talk about policy, you talk about the design of policy, you talk about, you identify the issues, you design what to do, how to go about it, you monitor it and you implement. You monitor the implementation, then you evaluate. In an ideal situation, government is supposed to work in tandem with civil society. Yes. We are supposed to support them, complement their efforts. But in our climate, several times, the civil society are looked upon as not partners. We are not constructively involved. And without our participation, because we wear the shoes, we know where it pinches.
We wear the shoes and we know where it pinches. So actually your participation in this platform, it's so critical, so valuable. And yes, and I think some things are going to come out that maybe never came out before. And maybe this time around we'll get it right.
I pray so.
We are going to be coming up with strategy documents, reports on innovations, and maybe leadership, initiatives, meta leadership initiatives that we expect, so that we can even fulfill the MDG goals and really reprioritize the value of African life, Nigerian life.
Welcome to Africa Health Innovation Meeting. Almost 7 years ago, we were looking at the possibilities for Africa to engage in sorting out its own HIV/AIDS problems, TB problems. And through a partnership with the Global Fund, we had the opportunity to increase the high-level advocacy in terms of participation in HIV/AIDS, TB and malaria in our countries. These diseases are in Africa. They touch us personally. We're not reading them in textbooks. These are lives and people, friends, brothers and sisters that we know.
Today we're talking about health and how important health is. Now, to define the context in which I'll be speaking from the context of the developing nation representing Africa, and also by WHO's definition of what healthcare is. And if I may quote, health is a state of complete physical, mental and social well-being, and not merely the absence of disease. I'll also be citing, because of my dexterity, a few issues to do with Nigeria to be able to buttress my points here. To my mind, healthcare is a universal right. It's a right for everybody on earth, especially in Africa, to access affordable healthcare of high quality. This is not a new phenomenon. There are so many universal consensus groups across the world that have proven that access to basic healthcare is a universal basic right. And if I should start, going back to 1978, we had the WHO Declaration, going a little bit more recently to the People's Health Charter, and even in our own country, Nigeria, we had the second Abuja Declaration, where heads of states came together and decided that 15% of their budgets need to be dedicated to healthcare. You and I in this room know that it's one thing to say, another thing to do. And therefore, it's very important that we make healthcare a very important topic, a huge pillar for us to put at the forefront to make sure that some of these declarations come to pass. In Nigeria, for now, we have only 6% of our national budget dedicated to healthcare. If we look at other countries, it is also very low. So what do we do to be able to make a change? In January 2014, in Davos, the World Economic Forum, leaders, presidents, CEOs, captains of industry came together, understanding the importance of healthcare in driving economic development, and made a consensus statement and had a major traction to make sure that healthcare is a major economic driver. Now, if we look at the world so far, look at where we are coming from. Look at the difference between developed nations and developing nations. What are the major drivers? The disease conditions that prevail us in Africa. When they paint Africa for happiness and dexterity and lovely things, we're always in the blue. But when it comes to disease prevalence, endemicity for malaria, AIDS, HIV, and so on and so forth, we are in the doldrums. What has happened over time? The developed economies have been able to use research and development to make a change in their economy. If we didn't have discoveries, we would still be pervaded with diseases like smallpox that was eradicated 30 years ago. So the onus is on us to be able to benchmark some of the successes of technology in the past and use them to galvanize a change in Africa. To my mind, healthcare has an intrinsic value. It goes without saying, and I'm bold to say, that healthier is wealthier. Good health is not only about outcomes, but it is the foundation of development. No health, no wealth. If you have healthy individuals, you have a society that is more productive, that will make more money, that will share more money, that will invest more money. Totally different from just investing in infrastructure. They'll consume more, they'll work longer hours, they'll be more productive, and at the end of the day, they have a direct impact on the GDP of our nations.
I'd like to say that poverty should be considered as a denominator, because when you are sick, whether rich or poor, you become very vulnerable. And I also want to comment on the capital flight, health tourism. And she made a statement that every year we have thousands of people leaving Africa to go to Europe and other countries for medical treatment. We still have the roads, we have the infrastructure, but there's something creeping into the health sector, which is the non-communicable diseases, the cancers, the kidney failures, the things that we cannot handle. So that makes African countries every year lose billions of dollars for people to go outside for treatment. So if we make health a priority, then we can train the specialists and build special hospitals so that we can treat our own cancer patients, do kidney transplant, even heart transplant here on the continent. So we need to look at it so that we can save money leaving Africa to European countries. Thank you.
I stand for the communities. I want to talk as a father and a mother. Yes, it's good. Education is wonderful. If your child is sick, sitting with you at home, no hospital to go to, as a mother, what do? Where is the teacher? Where is the school? Let us not deceive ourselves. How we should go to make presentations on slides, I would have asked our policy makers, just one slide to speak. When we direct our campaigns, why don't we direct it to the senators? We go to living people. So our policies and ideologies should be what will keep people alive and healthy. Health is what I think health is.
The community owned its own solutions. Hospitals were built, doctors were trained by the efforts of the communities. They came together, collected money, and sent their children to go and train as doctors. I know that in our Odezob, which is where I come from, the Ojike Memorial Hospital was built by communal effort. At what point did we begin to lose all this? At what point did we begin to look at government and international donors as the only people who can help us? You asked a question earlier. The number of people under the poverty line, uneducated, uninvolved, how can they begin to affect policy? There is one way.
Yes, tell us.
And that is in the local government. Engaging them. The people know where the shoe pinches. We are building apps whereby telephone is what your driver, your cleaner, your grandmother, your great-grandmother has. And if they can key into this and be trained to use those applications, they can access almost on a daily basis what program is there for me. What's the nearest health center? How can I access free medical?
Well, viewers, you have seen it and you have heard it all. There is need to accelerate solutions. In fact, the word used is leapfrog. Let's leapfrog the challenges, developmental challenges and all the other challenges, and really achieve solutions to improve life expectancy here. Stronger partnerships between private and public sector, less dependence on international agencies for financing. Let's do more with our domestic finances. Let us have better performance service. Let us have a better enabling environment. Let us be more concerned about health care delivery here. Thank you for watching.